The ways in which pregnancy is prevented is known as contraception. These methods prevent the sperm from being able to fertilise an egg. Contraception includes a variety of hormonal-based and non-hormonal-based methods. Let's take a look at some hormone-based methods. These methods use the hormones of the menstrual cycle to prevent pregnancy. The most common method is taking a contraceptive pill. These pills can have different amounts of the hormones in them. For instance, one pill has estrogen and progesterone in it, while another only has progesterone. The first pill is known as a mixed pill, and it inhibits the release of FSH, and so this means no eggs are matured. On the pill, the uterus lining doesn't build up either. The other pills, containing only progesterone, have to be taken at the same time every day to be effective. This pill, however, does have less side effects than the first pill. These side effects could include high blood pressures and breast cancer. Instead of taking a pill, an implant, injection or patch can be used to get the hormones into the body. Implants are where something containing progesterone is inserted under the skin to slowly release the hormone. Injections of progesterone only last a short time, and the patch releases progesterone and estrogen, and it is replaced once a week. There are a variety of different methods used which do not involve these hormones. The first most obvious method is abstaining from sex. If people stop having sex, then they won't be able to get pregnant. Some religions only believe in this method, and when people periodically do not have sex due to it being near the ovulation part of the cycle, it is known as the rhythm method. This can be very hard to manage though, and it is often quite risky. Surgery is another option. Men can be sterilised by having a vasectomy, where the sperm ducts are cut so no sperm is released. In women, the oviducts can be cut too. Chemicals can also be used to kill sperm. However, using chemicals is found to be often ineffective. Barrier methods are one of the most common forms of contraception. They prevent the sperm from reaching the egg. Condoms can be used, and these are quite useful as they also protect against STIs. Another, less widely used option is a diaphragm. This is placed over the cervix, and it must be done by a doctor. Intrauterine devices are the final method we are going to look at. They are devices which prevent the implantation of an embryo. Other types of these devices will release a hormone, such as progesterone, to prevent the building up of the uterus. Let's move on to the higher tier topic. Infertility can be brought about due to a wide variety of reasons, from a lack of sperm to damaged oviducts. These conditions can be brought on by a poor diet amongst other things, but most commonly, infertility is linked to age. If infertility is caused by an imbalance of the female hormones, it can be easily rectified. For instance, if not enough FSH is released, then FSH can be prescribed in a tablet, and so on. IVF is then used if the factor causing infertility cannot be easily rectified. In IVF, the eggs are matured using FSH, ovulation is induced using LH, and then the eggs are removed from the ovaries. Once the eggs are removed, they are fertilised in a lab. Donor sperm can be used if the issue is with the sperm count. The eggs are nurtured so that they develop into embryos before being reinserted into the uterus of the mother. Sometimes, more than one of the fertilised eggs are inserted into the uterus to increase the likelihood of success. IVF can sometimes be risky, and so you have to see if the risks are worth the benefits. First of all, it is not always going to be successful, it can become very expensive, it can have a stressful strain on both the father and the mother, and of course, ethical concerns have to be considered. However, despite all this, IVF is a method which allows couples who can't have a baby to have one.